Some patients who have been diagnosed with cancer ultimately will require chemotherapy. Let's find out some fact or fiction about what chemotherapy really means. Hello everyone, I'm Joe Basichia along with Dr. Seth Berk. He's a medical oncologist and hematologist at Virtua. Glad to have you with us.
Thank you.
First of questions, I'll hit you with some fact or fiction you could tell me. Chemotherapy is different than radiation.
That is correct. Chemotherapy is medication that is ingested in the body, travels through the body, and has been created to kill cancer wherever it may exist within an individual.
Does chemotherapy come in one form?
Chemotherapy can come in both an intravenous form and an oral form. Historically, early chemotherapy medicines were administered only through the intravenous route. But more recently, many new exciting chemotherapy agents are offered in tablet form as well.
Here's a fact or fiction. Chemotherapy rarely works.
That is fiction. We have many exciting chemotherapy medicines that can help individuals with cancer in remarkable ways. Sometimes the chemotherapy is able to cure an individual of a disease that they otherwise would not be able to survive, and other times chemotherapy can markedly improve individuals' lives by reducing their symptoms of the disease and helping them to live longer.
Fact or fiction, chemotherapy makes a patient very sick.
That is both fact and fiction. There are certain chemotherapy medications that will make a person quite ill. The difference between 30 years ago and today is we have so many wonderful supportive medications to markedly reduce a person's risk of developing significant nausea and fatigue. In addition to that, we also have many newer agents with a very favorable toxicity profile. Any medication will have a side effect. It's the extent to which that side effect may interfere with a person's capacity to function that's markedly changed over the years.
So in other words, we've really come a long way when it comes to chemotherapy, and this is a wonderful tool to have.
Absolutely. Fact.
Fact it is. And it's good to have Dr. Seth Berk with us. He's a medical oncologist and hematologist at Virtua. Of course, to learn much more about Dr. Berk or any of our doctors at Virtua, please go to virtua.org.